So yes, hi guys, good morning. And yep, today is July 23. It's 12 in the morning, almost 1. And yes, this is my first collaboration with Miss Yanna. Hello po Miss Yan, one of my good friends here sa TikTok. And yes, she helped me verify, she helped me correct everything. Like mistakes, mali ko ng paglinya, even the medications, and even the pathophysiology itself ng tetanus. Miss Yanna helped me a lot, and she urged me to do more and be more. Yeah, especially because second year na tayo guys. We'll be dealing a lot of pathophysiologists and normal and abnormal shits and what yun siya. So yeah, kidding aside, or yeah, should I say, or I don't know. Like, I'm out of words. Pero ayun, going back to the topic, this is tetanus. Tetanus guys, tetanus. Yeah. It's tetanus. Okay, so I would dub this Teta-notes. That one. This is my first collaboration, by the way. Yeah. And I'm very honored. Pasensya na utal ako. I'm very honored to be proofread, guided, and nourished, kumbaga, by Miss Yanna Espiritu. You can follow her on TikTok. I'll put the link down below. And yes, don't forget, please. She's one of the good friends that I have, and she's one of the best lecturers out there. Yeah. So go check her account and please subscribe and appreciate her work. Yeah. And yeah, ewan ko, nahiya talaga akong promise. But yeah, this serves as the first collaboration between the two of us. So go check it out. And yeah, I guess that this would be a 2-hour long video, I guess. Parang nakikitaan ko na siya, hindi ko alam. Pero let's see how it goes. Okay, so yeah, it's tetanus. Yeah, it's tetanus, by the way. So yeah, okay, perfect. So guys, to ask you or to give you the definition of tetanus, so yeah, tetanus, bakit may ganito siya? Wait lang. Paano siya i-change? Okay, sige na, whatever. So yeah, what's tetanus? So yeah, hindi kasi maalis itong white, gray na na bar dyan. I cannot adjust. Hindi siya ma-adjust. So sige, let's continue, by the way. So yeah, what is tetanus guys? Tetanus is lockjaw. It's from the ancient Greek, which means tension, stretched and rigid. Because tetanus guys, it's a serious, potentially fatal neurological disease caused by the toxin-producing bacterium Clostridium tetani, characterized by muscle spasms which usually lasts for a few minutes and occur frequently for 3 to 4 weeks. Some spasms may be severe to fracture bones. Another symptoms would be like fever, sweating, headache, trouble swallowing, mataas ang heart rate, and your blood pressure. So the onset of symptoms, that's typically 3 to 21 days following the infection, and recovery may take months. Therefore, approximately 10% of cases are fatal because your Clostridium tetani is commonly found in soil, saliva, dust, manure, and they enter through a break into the skin, and they produce tetanospasmin, which interferes with normal muscle contractions. And yeah, disease doesn't spread between people and can be prevented by immunization with tetanus toxoid. And to those with significant wound and had less than 3 doses of the vaccine, both tetanus toxin and the human tetanus immunoglobulin, which is being like associated, or shall we say results to this one, wound clean or necrotic tissue removed. That's surgical debridement, I guess. Basta malalaman natin yan later, okay? And to those infected with tetanus, this one, the IVIG plus, or the human tetanus immunoglobulin. So the etymology, how to pronounce tetanus. Yes, as an English major, guys, tetanus or tetanus, okay? Okay, that's the ano, yung nakabaliktad na E, tetanus, okay? That's from the Greek. I cannot say this because I cannot speak Greek, which means thought. From the Greek, this one, that's to stretch, okay? And the history of tetanus, guys. Your tetanus is well known to ancient civilizations. In 1884, German internist Arthur Nicolaier isolated the strychnine-like toxin of tetanus from non-living anaerobic bacteria. In 1884, the etiology of disease, guys. In my school, disease, Chares. Yeah. The etiology of the disease is elucidated by Antonio Carlo and Giorgio Ratone, who are pathologists at University of Turin, Italy. They demonstrated, guys, the transmissibility of tetanus that's produced in rabbits by injecting pus with tetanus into their sciatic nerves and tested reactions. In 1891, Japanese physician Kitasato Shibasaburo isolated C. tetani from a human victim who later showed that the organism could produce disease when injected into animals. And in 1897, French veterinarian Edmond Nocard showed that tetanus antitoxin induced passive immunity in humans that's used for prophylaxis and the treatment as well. And in 1924, P. Descambe developed the tetanus toxoid, and that's widely used to prevent tetanus induced by battle wounds during World War II. Okay? The epidemiology. Ooh. For the agent and reservoir, bakit nakabaliktad ang O and I? Nahiya ako, guys. English major ako, pero magkabaliktad, no? Yan siya. Pasensya na, guys. Tao lang. Reservoir. That's the tamang spelling. For the reservoir, Clostridium tetani is an aerobic gram-positive spore-forming bacteria. And yung spores daw niya, guys, are ubiquitous in the environment that's found globally in soil, ash, street dust, and even the intestinal tracts and even feces of animals and humans. For the environmental factors, the spores of C. tetani are highly resilient. They resist mild heat, drying, and even disinfectants. And the spores thrive in warm, fertile, organic soil and humid tropical climate. For the global distribution, the highest burden of disease is concentrated in South Asia and Sub-Saharan Africa. Some of the factors are limited access to clean delivery practices, low vaccine coverage, agricultural occupations that involve soil exposure. And for the whole susceptibility transmission, the C. tetani, Clostridium tetani, cannot invade healthy, oxygenated tissue. Transmission requires a specific portal of entry that creates an anaerobic environment. By the way, the portals of entry are deep puncture wounds, contaminated lacerations, compound fractures, even animal bites. Diba? Ito, suki ako ng animal bite. Oo, every year. Hindi pwedeng hindi ako kagatin ng dog or miming. So, kasali rin yan. Oo. Kasali rin yan sa prevention and sa treatment. Ang tetanus toxoid. Oo. Even burns or frostbite, even unsterile surgical procedures, contaminated injections, including unsafe drug use, unsterile delivery practices, and even minor or unnoticeable injuries. For the risk factors, pag low vaccine coverage, that's with the newborns or postpartum mothers, which is when contaminated umbilical cord cutting, or even lack of maternal anti-tetanus antibodies. For the high vaccine coverage, that's for the about the elderly adults, and even unvaccinated individuals, which wanes immunity and lack of 10-year booster compliance and injection drug uses. For the mortality, the incubation period, as what I've said earlier, that's from 3 to 21 days and average 8 days. Okay, shorter incubation period correlates directly with a higher or increased toxin bind, closer proximity of the wound to the CNS, the central nervous system, and even poor prognosis. Case fatality rate 100% in neonates and even vulnerable elderly adults. Okay? So, before everything else, dito tayo sa C. tetani. Okay, what's Clostridium tetani, guys? It's the common soil bacterium that's a causative agent of tetanus. Therefore, the vegetative cells of C. tetani are usually rod-shaped, up to 2.5 micrometers. Ang liit. Long, but they can become enlarged, like tennis racket or drumstick shape. Yun ang mature, kumbaga. Yeah. When forming spores ito, hindi spasms, correct me. Spores are extremely hardy and can be found globally in the soil and even the GI tracts of animals. And if inoculated into the wound, Clostridium tetani can grow and produce tetanus spasmin, which interferes with the motor neurons. Ang characteristics nito, guys, C. tetani is a rod-shaped, gram-positive bacterium up to 0.5 micrometers wide and 2.5 micrometers long. It's motile by the way of various flagella. Flagella meaning hair-like structures outside the the cell body, kumbaga, that surrounds its belly. And Clostridium tetani cannot grow in the presence of oxygen kasi nga anaerobic, doon sila nagto-thrive. And it grows best at temperature ranging from 33 to 37 degrees Celsius. And upon exposure to various conditions, Clostridium tetani can shed its flagellum and form a spore. Okay? Each cell can form a single spore, generally at one end of the cell, and it gives cell a distinctive drumstick shape. Nagutom tuloy ako. Yeah. And spores are extremely hardy and resistant for antiseptics and even boiling for several minutes. And they are long-lived. Wow! Long-lived. Yeah. History, almost the same siya with the history. Almost the same siya with the history of tetanus. 4th century BCE, before Christ era. The clinical descriptions of tetanus associated with wounds are found in Hippocrates' aphorisms. 1884, yung kay Nicolaire. 1889, yung kay Shibasaburo. 1890, it was found that the effects of inoculation of the aggression in the human body was due to chemical products at immediate vicinity of point of inoculation. And in 1897, Sinocard. And in World War II, injection of tetanus anti-serum from horses was widely used as a prophylaxis against tetanus. And yeah, in wounded soldiers. And therefore, bumaba ang tetanus cases over the course of the war. Yes, mga bata. Charing. Charing lang. In 1920, si Gaston Ramon, the modern method of inactivating tetanus neurotoxin with formaldehyde was developed by him. And si Discombi, he developed the tetanus toxoid vaccine. And additional details, guys. The Clostridium tetani can be grown on various anaerobic. They do not need oxygen to live. Yeah. Like your thioglycolate media, casein, hydrolysate media, and even blood agar or agar. And the cultures grow on media at a neutral to alkaline pH, supplemented with reducing agents, and the genome of a Clostridium tetani strain has been sequenced, containing 2.8 million base pairs with 2,373 protein coding genes, but we're not diving deep into that. Ang scientific classification niya, this one, and ang binomial name is the Clostridium tetani in 1881 by Flug. Okay? Flugay or Flug. Okay? So yeah, the most awaited part, papunta na po tayo sa exciting part, ang pathophysiology. Ang pathophysiology, ito yung part na pina-proofread ko po kay Miss Yanna, and may go signal siya, and I did the thing. Okay. Yung mga mali na nalagay ko, I corrected it before filming this one, and grabe. Maraming mali, yes, oo, pero I managed because of Miss Yanna's guidance, na manage ko ng correct. Kasi may mga mali akong na-point out, and even mali ang explanations to some. Therefore, it's an honor talaga, promise. Yeah. No joke. Oo. So yeah, for the pathophysiology, ito. I've put here the predisposing factors. What are the predisposing factors? First would be the immunological factors. That is the lack of active immunity, pag incomplete or missing vaccinations, and even waning immunity. That is failure to receive a booster dose every 10 years, because the antitoxin titers decline over time, leaving older adults vulnerable. And even maternal non-immunization. Wala siyang protective immunoglobulin G antibodies. Okay? And even environmental and occupational exposures, like your agricultural and plantation workers, diba? They have or they are in frequent contact with soil that's enriched with animal manure. Manure is mga defecation. Oo. Agricultural tools, and even sharp vegetation, like your thorns and even rough plant materials. For the construction and industrial laborers, that's increased risk for crush injuries, deep punctures from rusty nails, and even contaminated lacerations. And for the geographical conditions, warm, humid climates with fertile organic soil, higher spore concentrations, and higher incidence rates, particularly in regions with limited healthcare access. And for the age, newborns, guys, kasi nga, infants born to unimmunized mothers lack passive immunity, and for the older adults, immunity naturally wanes over time. Older populations statistically are less likely to stay up on date on booster shots. Even socio-economic factors like the limited access to healthcare facilities, lack of education regarding wound management, and even birth deliveries outside sterile medical environments. Even comorbidities like your diabetes, diabetes, guys, and vascular diseases. And for the myth, guys, ang misconception daw, guys, ang rust daw that causes tetanus, but rust itself is not the cause or the danger. Rather, rough and rusty outdoor objects simply tend to be dirty environments where Clostridium tetani spores naturally reside. Any object, mapa-clean or dirty, metal or wood, that introduces without a deep wound poses a risk. Okay? So, yeah. And for the precipitating factors, yung wounds, guys. For the precipitating factors, wounds, like your deep puncture wounds caused by nails, splinters, needles, animal bites, which easily trap bacteria beneath the skin and seals away from atmospheric oxygen. Second one would be the necrotic or desensitized tissue from crossing injuries, severe burns, frostbite, which halts local blood flow, that cuts off supply of oxygenated blood. Even foreign bodies, guys. The third one, presence of soil, dirt, feces, dust in a wound, that provides a protective niche for spores and accelerates infection. And for the co-infection with pyogenic bacteria, simultaneous infection with aerobic bacteria consumes local oxygen, which drives down the oxidation reduction potential of the tissue and creates a perfect anaerobic environment for Clostridium tetani. Even portals of entry. Skin lesions like your bread sores, foot ulcers for the diabetic people, chronic gangrenous lesions where necrotic tissue is present, even obstetric and neonatal, like yung sinabi ko kanina, the unsterile delivery conditions, which involves cutting the umbilical cord with non-sterile environments, which cause tetanus neonatorum, and even septic abortions. Surgical or invasive procedures using non-autoclave instruments, contaminated sutures, unsterile injections, including illicit drug use with skin popping or contaminated needles, and minor trauma, otitis media, which can predispose to cephalic tetanus of the tympanic membrane is perforated. Dental abscesses, superficial abrasions ignored by the patient. So guys, for the most awaited part, the mechanism of progression. Okay. Sa soil daw guys, dust, concrete, and rusted metal, even marine sediments, dito nabubuhay si Clostridium tetani guys. And that Clostridium tetani enters through compound fractures, crushing injuries, frostbite, even burns, and even animal or insect bites, puncture wounds, cuts and scrapes, and wounds contaminated with dirt or feces, unsterile surgical wounds, lacerations, and even unhygienic practices. Okay? And guys, if a wound contains necrotic tissue, foreign bodies, and even co-infecting microbes like the Staphylococcus aureus, Streptococcus pyogenes, Escherichia coli, and all of this, yep, they will join forces. Therefore, the local oxygen is depleted. Pag na-deplete si local oxygen, lowering ang oxidation reduction potential, which triggers spores to germinate into active vegetative bacilli. Pag itong bacilli na ito, they multiply and undergo lysis to produce these two, tetanus plasmin and tetanolysin. Okay? So, yeah. But before that, tetanolysin guys, balik muna tayo sa first na tawag nito slide or first page. 'Di ba? Sinabi ko kanina, ang Clostridium tetani, they secrete, kumbaga, tetanus plasmin and even tetanolysin. So for the tetanus plasmin, another terms, tetanus toxin, spasmogenic toxin, tetanus neurotoxin, or tentoxylizin. That's extremely potent neurotoxin produced by the vegetative cells of Clostridium tetani in anaerobic conditions. So for the LD50 or the lethal dose, 'di ba? Pag lethal dose, the lower the value, the more toxic the substance. So yeah. Second, ang tetanus plasmin to botulinum for the toxicity, kumbaga, which is approximately 2.5 to 3 milligram per kilogram, and it spreads to the tissue spaces into the lymphatic and vascular systems, and it enters the nervous system through the neuromuscular junctions and migrates to the nerve trunks and into the central nervous system by retrograde axonal transport by using dyneins. Okay? For the structure lang muna dito ha, to give you a glimpse, it's 150 kilodaltons and 1,315 amino acids, and chains are connected by a disulfide bond. Okay? So for the light chain, yeah, it functions as a zinc-dependent metalloprotease, and once inside the neurocytosol, it acts as an enzyme that specifically targets and clears synaptobrevin or yung vesicle-associated membrane protein. And ang heavy chain, may dalawa siyang two halves. Yeah, dalawa siyang two halves. Ang galing. The binding domain, it binds tightly to GT1B, polysialogangliosides and GPA-anchored proteins on the presynaptic membranes. And for the translocation, that pore allows the unfolded light chain to slide directly into the cell's cytoplasm. And for the tetanolysin, that's an exotoxin, a toxin produced by Clostridium tetani that's sensitive to oxygen and belongs to a family of protein toxins known as thiol-activated cytolysins, which bind to cholesterol, and it acts as a potent hemolysing. Okay, it actively lyses red blood cells, platelets, and even immune cells. And ang structure, to give you a glimpse again, is 55 kilodaltons and may apat na domains. These are the domains. Yeah. The D1, ang function ni D1, it coordinates the lateral monomer to monomer interactions during the assembly phase. D2, That acts as a structural stock linking D1 to D4. Ang D3 that contains two specialized clusters of alpha helices which refold into amphipathic beta hairpins that physically pierce the bilayer, and D4 recognizes and binds to cholesterol molecules on the whole cell membrane to anchor the toxin. So, baba tayo muna for a while. Okay, balik tayo. Okay, nasa na ganito tayo? Okay, di ba ang active vegetative bacilli, this one, they multiply and undergo lysis, which produce this too. Di ba yung tetanolysin, that is a hemolysin that locally destroys tissue. What is a hemolysin? Sino ang tatamaan niya? The red blood cells. Eh, pag dinestroy niya ni tetanolysin si red blood cells, bababa ang oxygen. Okay? And for the tetanus plasmid, I have put here the heavy and the light chain, diba? As what I've told you earlier. The heavy chain mediates neurospecific binding of the tetanus toxin to the nerve terminal membranes, and the tetanus toxin, guys, binds to the GT1B, polycyanoglycosides, and even the GPI anchored protein receptor specific to the tetanus neurotoxin. Pag nag-bind siya dyan, it triggers endocytosis into nerves that will result to retrograde axonal transport. And pag meron din siya, it will undergo again transcytosis into the central nervous system inhibitory interneuron in two pathways, synaptic vesicle 2 dependent, and even the synaptic vesicle 2 recycling system. Once inside the interneuron, it will undergo translocation, which is mediated by low pH and even temperature. Pag low ang pH, guys, it causes a conformational change from water-soluble to hydrophobic form, and once exposed, the tetanus neurotoxin can slide into the vesicle membrane and forms ion channels in the membrane non-specific for sodium, potassium, calcium, and chloride ions, and allows the light chain to liberate as a free thiol. So, balik tayo. Pag may translocation, once it is done, it will undergo chemical reduction of the disulfide bonds. Diyan na mag-occur. Okay? Same pa rin. Pag merong reduction, chemical reduction, the light chain liberates as a free thiol, and it targets synaptobrevin, which cleaves the glycine 76 and phenylalanin 77. This is 77, guys. For a while. Yeah, this is 77. Okay? Wait lang. I'll put it for disambiguation. Okay. Phenylalanin 77. Okay, perfect. So, yeah. Pag tinarget ito si glycine 76 and phenylalanin 77 bond, it will go, or it will result to destabilization of the snare core complex, which is restricted from low energy conformation, which results to NSF or N-ethylenamide sensitive factor binding blockage. Pag na-block siya, it interferes with exocytosis of neurotransmitters, which stops release of excitatory neurotransmitters, and it blocks release of your GABA and your glycine. Pag na-block si GABA, guys, ang motor neurons mag-overreact siya and walang motor reflex. Pag wala itong dalawang ito, or pag nagkaroon itong dalawang to, or pag meron itong dalawang to, it will cause generalized contraction of agonist and antagonist musculature. Therefore, dito na tayo, tetany spasms na, or even violent spastic paralysis. So, after that, may mga types tayo of tetanus, guys. 4 yan. The generalized, neonatal, localized, and cephalic. Okay? For the general, that's the most common form. It accounts for approximately 80% of cases, and that occurs when the neurotoxin enters the bloodstream and lymphatic system, which results to widely spreading to affect motor neurons throughout the body from the head downwards. Ang symptoms, guys, trismus or lockjaw. That's the tonic spasms of masseter muscles. Masseter muscles, that's your cheek muscles, di ba? Correct me if I'm wrong. That's the first presenting symptoms. Rhesus sardonicus or sardonic smile. That's the grim-looking sardonic smile, yes. That's caused by sustained contraction of the facial muscles and opisthetanus. That's arching, spasm of the spine, back, and heels forward. And even dysphagia due to pharyngeal muscle spasms and full body spasms triggered by minor external stimuli like your loud sounds, bright lights, and physical touch. And even sympathetic overactivity, which results to labile blood pressure, tachyarrhythmias, hyperpyrexia, and even profuse sweating. That's for the general one. For the neonatal, that's a specialized form of generalized tetanus that occurs in newborns, hence the name. Okay, that's generally within the first 2 weeks of life, and that's highly prevalent in developing regions where mothers lack adequate tetanus vaccination and unsterile techniques that are used to cut or dress the umbilical cord. For the symptoms, guys, that's the first symptom is inability to suckle or feed. Okay, that's the inability to nurse due to developing lockjaw, and that's the first presenting symptom sa neonatal tetanus. Excessive or inconsolable crying. Hindi siya ma-pacify. Generalized rigidity, spasms, and even the opisthetanus. Okay? For the localized, that's the uncommon form. Ang muscle spasms and rigidity remain strictly confined to the anatomical region or muscle groups immediately surrounding the initial wound site. Localized gani, kung sa kamay lang, kung paa lang, yun siya. For the symptoms, fixed, continuous contraction of muscles in the affected limb or area, even localized spasms, and increased risk of progression to generalized tetanus if left untreated. And P.S. Symptoms can persist for weeks or months before gradually resolving. For the cephalic, ulo guys, ulo. Okay, rare. That's a rare, localized form limited to the head and neck or face and neck, and that's typically occurring after head trauma, otitis media, or even cranial lesions. For the symptoms, trismus pa rin, and same rin, increased risk of progression to generalized tetanus if left untreated. Okay? Even extraocular muscle weakness. Di ba? Cranial nerve involvement. The cranial nerves 3, 4, and 6. 3 is oculomotor, di ba? 4 is olfactory, optic, trochlear, and even 6 abducens, and even cranial nerve palsies, which presents with flaccid paralysis rather than spasms, and facial nerve that's most frequently involved, that means Bell's palsy. Okay, for the diagnosis, I have put here the primary diagnosis, secondary diagnosis, and the per type, yung 4 na types. Mamaya na tayo sa per types, dito muna tayo sa primary diagnosis. For the primary diagnosis, for the core clinical diagnostic criteria, it requires the presence of at least 2 of the following clinical features, like your lockjaw, rhesus sardonicus or sardonic smile, opisthetanus, or reflex-induced spasms. For the spatula test, yun yung parang lagyan mo ng yung tongue depressor, yung tongue. Pag normal, healthy ang gag reflex. Pero if positive, mababite niya yung spatula or tongue depressor instead of mag-gag. Okay? For the exposure history, pag may history siya of contaminated puncture wounds, laceration, compound fractures, or even animal bites within the past 3 to 21 days. And as I've told you earlier, average incubation is approximately 8 days. For the secondary diagnosis, first would be the serum calcium and magnesium. That's to rule out hypocalcemic tetany, which presents with severe muscle spasms and cramps but lacks the autonomic dysregulation seen in tetanus. For the positive, less than 8.5 milligrams per deciliter. For the hypocalcemia or less than 1.5 milligrams per deciliter, which signifies or which states hypomagnesemia, which points away from tetanus and toward metabolic tetany, which can be rapidly reversed with calcium gluconate. And negative metabolic tetany, normal lang siya. Okay? Toxicology, serum and serum drug levels. That's the rule of strychnine poisoning, which clinically mimics tetanus by blocking glycine receptors. And the dystonic reactions caused by neuroleptic or antipsychotic medications. Pag positive siya guys, serum detects strychnine or increased levels of antipsychotics or antiemetics, which will be resulting to drug-induced extrapyramidal reactions. And for negative, walang substance nakikita. CSF analysis that's performed if meningitis or encephalitis is expected. In tetanus guys, ito, CSF parameters like your cell count, protein, glucose remain normal. And yun, alam mo naman guys, in CSF analysis, that's a lumbar puncture. Okay? Pag positive guys, pag positive siya, it shows pleocytosis or elevated white blood cells, mataas ang protein, baba ang glucose. Pag negative, clear ang CSF, normal pressure, normal protein, normal glucose. Okay? Pag serum creatinine kinase, ang creatinine kinase is an enzyme heavily concentrated in skeletal muscle tissue. Violent muscle contraction of tetanus cause physical tearing and even breakdown. Pag positive si serum creatinine kinase, mataas, malamang. And severe muscle injury which alerts the medical team to flush the kidneys to prevent myoglobin clogging the renal tubules. Pag negative, normal. And ang normal is less than 200 units per liter. ABG guys, arterial blood gas, and even electrolytes. And you know guys, pag positive, ang ABG, it shows respiratory acidosis. And patient cannot ventilate and clear oxygen. And also, pag positive, you may see metabolic acidosis from tissue hypoxia, fluctuating potassium levels driven by cell breakdown, triggers mechanical ventilation. Pag negative, normal lahat. Okay? For the renal function tests, like your blood urea, nitrogen, and even creatinine, that's used to track whether the kidneys are failing due to the toxic payload of broken down myoglobin, and even severe fluctuations in blood pressure. Pag positive, mataas blood urea, nitrogen, and ang serum creatinine, which is around or greater than 1.2 to 1.5 milligrams per deciliter. That signifies acute kidney injury, and it requires immediate fluid optimization or temporary dialysis. For the negative, baba. Aerobic wound culture guys. I-wound culture mo yan. Pag positive siya, merong Clostridium tetani na nag-grow sa culture na yon. Identifying it under the microscope is classic drumstick or tennis racket. Kung nakita nyo yung drumstick or tennis racket, ganun ang shape niya. Okay? And swarming motility on agar or agar. It confirms, guys, that the bacteria are present in the wound, but it does not prove they are producing toxin. Kasi nga, wound culture, pinapakita lang, guys. Pinapakita lang ang yung mismong muka ng Clostridium tetani, not the activity. Okay? And pag negative, ito. Pag negative guys, walang Clostridium tetani grows. Okay? Bakit guys? Malay ko. Char lang. Yeah. So yeah, this does not rule out tetanus guys, as what I've told you, because Clostridium tetani is a strict anaerobe. Exposing a wound swabs to oxygen even for a few seconds can kill the mismong Clostridium tetani. And lastly, for the secondary diagnostic tool, the serology or even anti-tetanus IgG, immunoglobulin G, antibody levels must be drawn before giving patient the tetanus immunoglobulin. For the positive, ELISA or enzyme-linked immunosorbent assay measures an anti-tetanus IgG concentration more than 0.1 international units per ml. Okay? Pag negative, less than. Okay? And patient lacks protective immunity against the tetanus neurotoxin. Dito tayo sa per type guys. Ang per type guys, nakalagay ako dito, wala siyang masyadong diagnostic tool, pero presenting symptoms lang. Okay? Because the diagnosis relies strictly on the history and the presenting symptoms. For the generalized, the trismus and opistotonos, and advanced triggers niya, labile, BP, tachycardia, diaphoresis, and even cardiac arrhythmias caused by loss of autonomic control. Neonatal, that's an inability to suckle or nurse due to lockjaw, clenched fists, generalized rigidity that's triggered by touch or light. Localized, that's persistent, painful, involuntary muscle contractions strictly on the affected limb or body region. Cephalic, flaccid, cranial nerve palsies, like your facial nerve, and muscle weakness or paralysis in the face. Yes. That's for the diagnosis. Okay? Paano ba to? Yan. For the treatment, dito tayo. Okay. Boom! So yeah, mahabang treatment ito guys. Kasi inaisa-isa ko. So yeah, for the isa-isa-isa, okay. Sige. Isa-isahin natin to guys. Oo. Ang treatment for the general, hindi pa tayo nag-per type ha. For the general tetanus treatment, first would be the immune globulin, yung tetanus antitoxin natin. Those are medications guys that are made up of antibodies against the tetanus neurotoxin that is used to prevent tetanus in patients who have a wound that is at high risk. And that's used to treat tetanus along with antibiotics, and also to who have not been fully vaccinated with tetanus toxoid, or even sa mga people na may HIV or AIDS. And that is used to treat tetanus along with antibiotics and even muscle relaxants. Usually IM siya guys, okay? And even part of the dose injected at the site of the wound. Standard prophylactic dose, that's 250 international units, but may be increased to 500 for severe wounds, okay? For the vaccination history, pag unknown or less than 3 ang doses, pag clean or minor ang wounds, vaccine dose 1 lang. Pag dirty or severe, kasali na si tetanus immunoglobulin. Pag less than or more than or equal to 3 doses, ang last booster niya is less than or equal to 5 years ago, di na kailangan. Okay? Pag more than 3 doses, pero ang last booster niya is 5 to 10 years ago, wala for the clean wounds. And even for the dirty and severe, booster lang. For the more or less, or shall we say, nakalimutan ko, greater or equal than 3 doses, which ang last booster niya is more or less than, or more, greater or equal to 10 years ago, booster vaccine for the clean, and even for the dirty, booster plus the tetanus immunoglobulin. Side effects lang guys nito ay pain at the site of injection and even fever, and allergic reactions may rarely occur. And it poses low risk of spread of infections like your HEPA-B, HIV, and AIDS, acceptable for use during pregnancy and lactation, and even IgG. It neutralizes unbounded molecules. Ang equine, guys, that's from horses, okay? That's common in the 1910s, and it's typically used in developed world due to the risk of serum sickness and even hypersensitivity, okay? Okay, ang surgical debridement guys, that's crucial guys for destroying the anaerobic microenvironment that yung si tetany thrives or lives. So yeah, ang entry wound must be thoroughly cleaned. Any necrotic tissue and foreign bodies must be surgically removed, and it opens up wound to oxygen, which destroys the environment required for vegetative bacteria to survive and replicate. And even metronidazole guys, ang metronidazole guys, that's the first line antibiotic for active tetanus. Ito siya. Drug class is nitroimidazole. Administration is IV or per ore. That's divided for 7 to 10 days with this tawag nito, recommended dosage, should I say. Ang MOA nito guys, ang MOA ba? Charis. Ang metronidazole guys, it enters all cells through passive diffusion and is susceptible anaerobic bacteria and protozoa, intracellular electron transport proteins, which transfers electrons to the drug's nitro group, and it activates drug into short-lived toxic nitroso-free radicals. Pag yung radicals nun, it interacts with microbial DNA. It causes loss of helix structure, strand breakage, or inhibition of your nucleic acid synthesis. And Ang activation process ng ito guys, it requires a low oxygen, low redox potential environment because human cells and aerobic bacteria do not have the same electron transport. Drug remains inactive and non-toxic to the healthy human tissue. And it's highly effective, guys, against obligate anaerobes like your B. fragilis and C. difficile. And even protozoa like your Giardia lamblia. Yung, yung parang yung eggs nito, yung parang yung immature, yung parang, yung sa sunglasses na, na teardrop ang face, yun siya. And trichomoniasis, basta T. vaginalis, yun siya. Side effects, nausea, vomiting, stomach cramps, diarrhea, unpleasant sharp metallic taste, dry mouth, loss of appetite, darkening of urine. And, ang alcohol guys, avoided siya guys. Oo, while taking for at least 48 hours after finishing the treatment because combining can cause hot flushes and even rapid heartbeat. Okay? And you have to seek medical attention if experiencing numbness, tingling, peripheral neuropathy, difficulty speaking, seizures, loss of balance, sudden severe headache, stiff neck, light sensitivity, feeling faint, fast irregular heartbeat, hives or urticaria, swelling of the face, and even trouble breathing, jaundice, or stomach pain. Ang advantage ito guys, it has better tissue penetration into ischemic wound areas and possesses no GABA antagonistic activity. Therefore, it doesn't exacerbate muscle spasms. Ito siya, penicillin G. G is for Charles. Penicillin G, guys, it's beta-lactams, okay? And yeah, penicillin G, that's historically, guys, the main antibiotic for tetanus. But it's now considered, guys, a second-line alternative ng kumbaga. Because ang high doses nitong penicillin G that can act as a GABA antagonist. Pag nangyari yun, it potentially exacerbates neuromuscular hyperexcitability and muscle spasms caused by the toxin. Okay, so yep. That's effective against gram-positive bacteria and certain gram-negative cocci, which is yung syphilis, strep throat, meningitis, endocarditis, and even diphtheria. And it works as a weak GABA antagonist, as what I've told you earlier. And side effects, guys, hives, rashes, anaphylaxis, pain, irritation, damage to the injection site, nausea, and diarrhea. Drug interactions may decrease effectiveness of certain immunotherapies, may cause issues when taken with oral contraceptives, and even anticoagulants, like your heparin, warfarin. Ang MOA, guys, Penicillin G features a 4-membered beta-lactam rings. Yung molecular structure niya mimics natural building blocks of your peptidoglycan, and it allows drug to bind irreversibly to bacterial penicillin binding proteins like your DD transpeptidase. Pag nangyari yon, it binds and inactivates. Mawawala ang cross-linking, pag ma-stop ang cross-linking, the weakened cell cannot withstand internal osmotic pressure. Therefore, matitrigger yung autolysis ni cell mismo, madidegrade, and hanggang sa malalysis. Administration, IV usually, and IM. Okay? So, ayun. Yeah. For doxycycline, those are tetracyclines, which are bacteriostatic. Pag bacteriostatic, guys, it stops growth and multiplication of your bacteria or even proliferation. Okay? Pag bactericidal, pinapatay niya. So, yung doxycycline, it's bacteriostatic. Okay? Those are broad spectrum, guys. Yeah. Tetracyclines, ang drug class, ang MOA ng doxycycline, it enters bacterial cell wall and attaches to the 30S subunit of the prokaryotic membrane, which blocks aminoactyl transfer RNA from attaching to the receptor site on messenger RNA ribosome complex. Pag nangyari yan, it prevents addition of amino acids. Pag nangyari yan, bacteria cannot elongate polypeptide chain, stop on production of proteins essential for survival and reproduction. Another, MOA niya, it inhibits matrix metalloproteases and prevents calcium-dependent microtubular assembly, which reduces immune migration and inflammation. Okay? Tetracycline, guys, similar lang siya with doxycycline. This is the dosing. Ang doxycycline side effects, nausea, vomiting, diarrhea, upset stomach, oral thrush. And doxycycline, guys, avoided siya to pregnant women and children less than 8, as it can stain permanent teeth and impair bone growth. And tetracycline side effects, nausea, vomiting, diarrhea, stomach cramps, similar to doxycycline. Pero may dagdag siya. Sore throat, vaginal or rectal itching, sun sensitivity, and even loss of appetite. Erythromycin, guys. Still, broad spectrum, macrolides, yes. Ang MOA niya, guys, would be erythromycin binds to the 23S ribosomal RNA molecule within the 50S subunit. The binding site, guys, it's located near the peptidyl transferase center, which physically blocks the polypeptide exit tunnel. Pag ganun, mahalt ang peptide chain elongation. Usually, administration ito oral. Oo. Yeah. And erythromycin is avoided in neonates less than a month due to the risk of infantile hypertrophic pyloric stenosis. Preferred si azithromycin. Okay? And must be used in patient with existing arrhythmias, congenital long QT syndrome, and even severe hepatic impairment. For the cefazolin, cephalexin, and cefadroxil, those are first-generation cephalosporins. Yeah. Cefazolin, guys, that's most common IM or IV use in hospital settings. Cephalexin, oral. And cefadroxil, oral but with a longer half-life. Ang MOA ni cefazolin, it contains a beta-lactam ring that binds tightly into PBPs or penicillin binding proteins, which blocks transpeptidase layer responsible for cross-linking peptidoglycan strands. Pag nangyari yun, bacterial cell wall is structurally weak and ma-activate ang autolysins and even murine hydrolases which degrade the cell wall. Therefore, more rupture si cell. Oo. Ang administration, IV infusion pa rin, yes, and IV bolus and even IM. Cefazolin side effects, mild headache, drowsiness, heartburn, diarrhea, nausea, vomiting, stomach cramps, loss of appetite, injection site reactions, even a hard lump where medication has been administered. Okay? And the contraindications, guys, contraindicated siya sa may mga allergy sa penicillin, and high doses can cause seizures, patients to patients with renal impairment, with GI condition history, and hindi siya recommended for premature infants and neonates less than a month of age. Diazepam and even lorazepam, those are benzodiazepines. Benzodiazepines or benzodiazepines? Correct me if I'm wrong sa pronunciation. Those are depressants, downers, yeah, to treat anxiety disorders, muscle spasms, acute seizures, and symptoms of alcohol withdrawal. Okay? Diazepam, tawag nito, MOA, yung MOA ni diazepam, guys, would be, it binds to a specific allosteric site on the GABA-A receptor complex located between the alpha and beta subunits. Pag nangyari yun, binding makes GABA more effective. Pag nangyari yun, may increase ang frequency with which the essential chloride channels open. Pag na-open siya, opening allows an influx of extracellular chloride ions into the neuron, and pag nangyari yun, ang influx of the extracellular chloride ions into the neuron, it drops the membrane potential below its resting state. Therefore, hyperpolarization makes the neuron highly resistant to excitation. Therefore, it dampens neurotransmission across the brain and the spinal cord. Ang pharmacological effects nitong diazepam, which would be decreased abnormal excitement in the limbic system, it depresses the reticular activation system to induce relaxation and sleep, it stabilizes neuronal membranes to stop or prevent seizures and treat status epilepticus, and even inhibits polysynaptic reflex pathways in the spinal cord to reduce muscle spasms and even toxicity. Administration usually oral, IM, IV, buccal, or rectal. Contraindications, guys, hindi siya pwede to patients with hypersensitivity to benzodiazepines. severe hepatic impairment, even acute narrow-angle glaucoma, and even COPD. The relative contraindications must use reduced doses to patients with a history of substance abuse. Bawal siyang gamitin as monotherapy for depression or anxiety. It precipitates suicidal ideation. And even side effects ng diazepam, drowsiness, muscle weakness, ataxia, dizziness, lightheadedness, dry mouth, nausea. Hindi siya nag-yes. Nag-joke ako guys. Nausea. Constipation, slurred speech. Aphasia bang slurred speech? Correct me if I'm wrong. Blurred or double vision. So, ayun. Okay. For the part 2, charis. The vecuronium, pancuronium, cisatracorium, those are non-depolarizing neuromuscular blocking agents. Those are potent, high-alert medications used to induce skeletal paralysis. Ang MOA ng vecuronium, guys, under normal circumstances, motor neurons release acetylcholine, and acetylcholine that binds to the nicotine receptors on post-junctional membranes of muscles. Therefore, pag nangyari yun, it opens channels that allow sodium to enter. That results in membrane depolarization and muscle contraction. And ang vecuronium that binds to the same nicotine receptors but doesn't activate. Doon lang siya, sit down lang siya. And it denies acetylcholine's ability to bind. Therefore, acetylcholine cannot stimulate the receptors. Therefore, ang muscle end plate cannot depolarize. Therefore, it leaves skeletal muscles flaccid and paralyzed. So, usually, IV bolus or infusion, and dosage niya, depende siya from the standard IV bolus, 0.8 to 0.1 mg per kilogram. That's the standard initial loading dose. IV infusion, and even dosing considerations for infants and children under 5 months, higher initial dose may be required. Vecuronium reversal. Paralytic effects can be reversed at the end of the procedure using Sugammadex. That's the neuromuscular blocking agents, antidote, or selective relaxant. Let me continue it here. This one. And even neostigmine, which is a cholinesterase inhibitor, even atropine, anticholinergics. Magsul. It is a mineral and electrolyte replacement which functions as an anticonvulsant, smooth muscle relaxant, and even osmotic laxative. Ang functions niya, guys, it treats and prevents hypomagnesemia, prevent and control seizures and pre-eclampsia and eclampsia, which is my video ako niyan. I will upload it whenever I want it to. Char lang. Yeah. If the sun would shine na lang. Tapusin ko muna ng HELP syndrome, by the way. It uncouples neuromuscular transmission by reducing acetylcholine release. It increases peristaltic activity by drawing water into the intestines to induce bowel or elimination. Even manage specific cardiac arrhythmias like torsades de pointe. Correct me if tama ako ng sinabi. Arrhythmias caused by digitalis toxicity. And even ma-relax niya ang smooth muscles to help manage acute asthma attacks. As a calcium antagonist, ang MOA ni Magsul, ang tawag nito, ang magnesium ions, they compete with calcium ions to block voltage-dependent L-type calcium channels on cell membranes. It reduces calcium influx into vascular smooth muscle and nerve endings, and by blocking calcium entry at the motor end plate, magnesium reduces the presynaptic release of acetylcholine, and it prevents muscle overstimulation and non-competitively inhibits inositol triphosphate receptors, which restricts release of stored cell calcium from the sarcoplasmic reticulum, and with reduced intracellular calcium or calcium-dependent enzymes become inactivated. Therefore, relaxed ang vessels, baba ang BP, reduces ang spasms. Okay? Topical siya, guys, IM, IV, and even oral. Ang side effects, if IV, common, Flushing, generalized warmth, nausea, vomiting, dizziness, headache, sweating, pag severe, loss of deep tendon reflexes, drowsiness, confusion, slow heartbeat, shortness of breath, baba ang BP. Toxicity, guys, untreated can result in respiratory paralysis, coma, or even cardiac arrest. For the oral, ang common is diarrhea, bloating, stomach cramps, upset stomach, severe dehydration, electrolyte imbalances, even bowel conditions. Therefore, you should always drink a full 8-ounce glass of water with each dose. For the topical, usually common, skin irritation lang and dryness, pag severe, infections na. Okay? Warnings, guys. Tataas ang risk for toxicity for patients with kidney problems. Antidote, calcium gluconate, pag Magsol. Contraindications ng Magsol is generally with patients with myasthenia gravis, heart block, and even myocardial damage, and even hypermagnesemia. Relative contraindications, give Magsol with caution to patients with pulmonary edema and renal impairment. And drug interactions, guys, co-administration with calcium channel blockers will result into baba ang BP, neuromuscular block. Esmolol, it's an ultra short-acting cardioselective beta-1 blocker. Okay, that's primarily used in intensive care, emergency, perioperative settings to rapidly decrease heart rate and blood pressure, specifically for conditions like your supraventricular tachycardia, atrial fibrillation, and even surgery-induced tachycardia. Okay, for the MOA, esmolol selectively targets beta-1 adrenergic receptors in cardiac tissue at therapeutic doses, which produces the following effects. It slows down the heart rate, reduces the SA, sinoatrial, di ba? Correct me if I'm wrong, node firing, decreased ang force ng heart muscle contractions, it slows contraction through the atrioventricular node. Okay? IV infusion sa, guys, and ang concentration can be given undiluted or diluted. If diluted, guys, typical compatible fluids include the 0.9% normal saline or even D5W. Okay? Contraindications, bawal siya ibigay sa patients with heart block, cardiogenic shock, COPD, and asthma. Side effects, bababa ang BP, dizziness, drowsiness, usually hives, shortness of breath, and even wheezing. Wheezing. Clonidine. Di ba artista to siya, guys? Nag-joke ako. Clonidine. Drug class, guys, would be the adrenergic agents, which are centrally acting alpha-2 adrenergic agents. That's a prescription medication used to treat ADHD, drug withdrawal symptoms, and even low blood pressure, hypotension. AMOA, for the hypertension, clonidine directly stimulates as an alpha-2 adrenergic receptors in the brainstem. Pag nangyari yan, its stimulation acts as a negative feedback loop, which inhibits sympathetic nervous system's output from the CNS to the rest of the body, and it stimulates imidazolin receptors, which decreases the sympathetic drive. Usually oral, suspension, transdermal patch, IM or IV. Side effects, dry mouth, drowsiness, dizziness, lightheadedness, constipation, headache, irritability, or even mood changes. Ang less common, palpitations, fainting, decreased heart rate, hallucinations, depression, hives, impotence, decreased sex drive. And even contraindications, guys. Patients with severe heart block, hypersensitivity, even on concurrent anticoagulant therapy. And lastly, for the general tetanus, pinagod ako nito, guys. Tetanus toxoid. Oo. Yeah. Drug class, it's toxoid. Yeah. Ang history, guys, sige. Charis. Yeah. For the history of tetanus toxoid, the first vaccine for passive immunity was disordered by a group. Alisin muna natin yan. By a group of scientists under the leadership of Emil von Behring in 1890. Grabe. And the first active tetanus toxin discovered and produced by Gaston Ramon in 1924, and the more effective adsorbed version that's created in 1938 was proven to be successful when it was used to prevent tetanus in the military during World War II. And the DPT, That's first used in 1948. That's continued until 1991. Okay? And yeah, yung DPT that we know now, the diphtheria, pertussis, and tetanus. Pertussis is whooping cough, by the way. And, sige, balik tayo. Ang first vaccine, guys, it is given to infants. Yeah. An infant, guys, is injected with the DPT, which is a cellular vaccine, safer than this one, the whole inactivated pertussis. Okay? Another option is DT. Nawala. Is as an alternative to infants who have conflicts with the DPT. And for every 10-year booster, that this thing may be used, this one. And women should receive a dose of Tdap vaccine during each pregnancy between weeks 27 to 36 to allow antibody transfer to the fetus, and it's recommended for pregnant women who have never received the tetanus vaccine to receive a series of 3 vaccines against maternal and neonatal tetanus. Ang schedule, guys, it's administered to children less than a year old, and recommended location usually sa anterolateral, and also can be injected into the deltoid. Yung kinagat ako ng miming last year, that was February or March or April, nandyan ang mga months, IM ang pagano sa akin ng tetanus toxoid. Yung sa sa hindi dominant. And there are 4 doses to be given in early childhood. First around 2 months, second around 4 months, third is around 6 months, and even fourth is from 15 to 18 months. Ang 5th dose, guys, is to be administered to 4 to 6 years old. Booster doses are needed because lymphocyte production is not at a constant increased rate of activity. That is because after the introduction of the vaccine, which lymphocyte production is high, the production of red blood cells will start to decline. The decline in T helper cell activity means that there must be a booster to keep the white blood cells active. And PS, lowercase DNP, that denotes lower strengths of diphtheria and pertussis. Guys, ang vaccine, ang tetanus toxoid, that is very safe during pregnancy and to those with HIV and AIDS. Usually, ang MOA, guys, when administered, the inactivated toxoid is recognized as a foreign antigen by the body's immune system. Therefore, the macrophages and dendritic cells, they clear the toxoid at the injection site, break it down, and present its fragments in the MHC class II molecules to helper T cells. Therefore, the helper T cells stimulate specific B cells to proliferate and differentiate into plasma cells. Therefore, ang plasma cells, they secrete high affinity IgG targeted specifically against the binding domains of the native tetanus neurotoxin. Therefore, the memory B and T cells are established. If exposed to C. tetani in the future, memory cells mount a secondary antibody response which neutralizes toxin, syempre. Which neutralizes toxin in the bloodstream before it can bind to nerve terminals. Side effects, guys, for the common, it's pain, tenderness, swelling at the injection site, usually low-grade fever or chills, joint pain, fatigue, mild nausea, loss of appetite. For the rare, fever higher than 38.3 degrees Celsius, blistering or even hard lump of the injection site, and even headache. You have to seek medical care if experiencing hives, itching, difficulty breathing or swallowing, numbness or tingling of hands, and even shoulder or arm pain. Contraindications: patients with anaphylaxis and even encephalopathy. You should be used, guys, with caution if a person developed Guillain-Barré syndrome within 6 months of a prior tetanus shot. Ang effectiveness nito, guys, near complete protection. Ang death nito, guys, from neonatal tetanus decreased from 787,000 in 1998, bumaba siya, into 58,000 to in 2010 hanggang sa in 2015 34,000 na lang. Ay wow, correct. So that's the general treatment for tetanus. Dito na tayo sa per type. For the generalized type early prophylactic endotracheal intubation or tracheostomy, because spasms can cause sudden bronchospasm and chest wall rigidity, making mechanical ventilation a primary life-saving measure. Magsol, kasali yan guys, Magsol, Esmolol, and even, bakit ito? Labetalol. Ano yung labetalol guys? They are third generation beta blockers. Ang target niya guys, it's alpha 1, beta 1, and beta 2. Okay? Sige. For the MOA, for the A1 or alpha 1 receptor, labetalol blocks alpha 1 receptors that's located in smooth muscles or peripheral blood vessels, which will result in vasodilation and even decreases the total peripheral resistance, which allows blood to flow more easily. Pag beta 1 receptor antagonist, it blocks beta 1 receptors located on the heart. Therefore, bababa si heart rate and even the myocardial contractility. And it also prevents reflex tachycardia. And for the beta 2 receptor antagonism, it non-selectively blocks beta 2 receptors in the bronchial and vascular smooth muscles. Yeah. Ito, must be used cautiously, avoided in patients with asthma and airway diseases, because blocking receptors can cause bronchospasm. Yes, bronchospasm. Yeah, bronchospasms, guys. Usually, IV and oral dosing, taken with food, IV, and even additional doses if need. Because PS, pure beta blockers strictly avoided due to the risk of sudden cardiac arrest and even alpha-mediated vasoconstriction. Side effects: stuffy nose, headache, dizziness, lightheadedness, fatigue, drowsiness, even nausea or mild stomach upset, cold hands and feet. Less common, that's an inability to maintain erections, decreased sex drive, vivid dreams, nightmares, slow or irregular heartbeat. Contraindications to patients with bronchial asthma, bradycardia, cardiogenic shock, even overt heart failure, and even hypersensitivity. And it can aggravate conditions like the Raynaud's phenomenon and even mask warning signs of hypoglycemia, and it's used with caution to patients with hepatic renal impairment and even hypotension and diabetes. Diazepam and even midazolam, that's still benzodiazepines, that's short-acting, used for sedation, anxiety relief, anesthesia induction, and even acute management for seizures. Yeah. Midazolam, guys, acts as a positive allosteric modulator that binds specifically to the benzodiazepine site located at the interface between the alpha and beta subunits of the GABA A receptor. Once bound, the drug increases the frequency of the central pores chloride channel openings, but it doesn't directly, guys, open the channel itself. It just makes it open more often when GABA is present. Therefore, the influx of the negatively charged chloride ions in the postsynaptic neuron makes the inside of the cell more negative than its resting state, which is hyperpolarization. And it raises threshold required for the neuron to fire. Therefore, by hindering the ability of neurons to transmit action potentials, the central nervous system is suppressed. Therefore, it results to sedation, muscle relaxation, even amnesia. In some cases, it's lipid soluble, guys, which allows it to cross the blood-brain barrier. This is the routes of administration: IAM, IV, buccal, intranasal, oral, or rectal. Some of the side effects would be drowsiness, dizziness, headache, nausea, vomiting, hiccups, dry mouth, and even pain, swelling in the injection site if na-administered siya, either IV or IM, anterograde amnesia, and even blurred or diplopia, double vision. Adverse effects: hypoventilation, airway obstruction, even apnea, decrease in blood pressure, tataas si heart rate, agitation, hallucination, even cardiac arrest in severe cases. Contraindications to patients with hypersensitivity and even acute narrow-angled glaucoma, and reduced doses to patients with sleep apnea, liver, kidney, and renal impairment, and COPD. Vecuronium, nasabi ko na kanina. And yeah, for the neonatal tetanus, The human tetanus immune globulin that's administered carefully at an adjusted dose, typically 500 to 1,000 units IM or slow IV. For a while, lagyan ko siya ng parenthesis. Perfect. Even surgical debridement, or even phenobarbital. What's phenobarbital? It's from the barbiturates family. It's a titrated weight-based IV combined with low-dose diazepam. Ito, ang MOA guys, phenobarbital binds directly to the GABA-A receptor complex, which increases the duration of time that the chloride ion channels remain open once bound. Therefore, it increases or the greater influx of negatively charged chloride ions into the neuron causes the cell membrane to hyperpolarize, making it more negative inside. Therefore, elevated ang action potential threshold that prevents neuron from firing. Therefore, tatas ang seizure threshold and reduces the spread of excitation. Usually administered IV and oral. Okay? And even side effects, loss of coordination, hangover effects, dizziness, drowsiness, slurred speech, fatigue, nausea, vomiting, constipation, general depressed mood. For the long-term risks, decrease ang calcium guys, hypocalcemia, osteoporosis, bone fractures, decrease in sex drive or libido, vitamin K, vitamin D1, or folic acid depletion. For the daytime sedation guys, 30 to 120 milligrams daily, divided into 2 to 3 oral IM or IV doses. Maximum this is 1 per day. Drug interactions can interfere with the effectiveness of hormonal birth control. Usually avoided si alcohol guys because it increases risk of central nervous system depression. And even contraindications guys to patients with sleep apnea, patients with barbiturate hypersensitivity, and you have to use in cautions with patient with liver and renal impairment, history of substance abuse, and anemia if it's caused by folate deficiency. For the localized encephalic, same lang siya guys, diazepam and surgical debridement. Okay? That's for the treatment. For the nursing management, still, nilagyan ko siya ng general and the per type. Itong apat na to. Okay? For the general nursing interventions, yan. Environmental control. For the environmental control, you have to place patient in a private, dark, quiet room, ideally in the ICU. And you have to eliminate sudden noises, guys, because you have to avoid slamming doors and keep monitor alarms in low volume outside the room if possible. Kasi nga, magte-trigger ng spasms yan. Okay? Pag malakas masyadong noises. And you have to speak softly before touching the patient. And avoid unnecessary manipulation and sudden movements. For the airway and respiratory management, you have to keep an emergency tracheostomy kit, endotracheal intubation supplies, and mechanical ventilator settings ready at the bedside. And you have to suction only when absolutely necessary, because as a physical stimulation of suction catheter can trigger laryngospasms, pre-oxygenate and sedate patient beforehand if required. Okay? And maintain a clear airway if patient develops tetanus. Conventional positioning becomes challenging, and spinal safety during spasms must be protected. Okay? For pharmacological management, yung kanina, HTIG, ordered antibiotics, even benzodiazepines, respiratory depression, you have to monitor that, and continue neuromuscular blocking agents may be used, continuous rather, if spasms threaten ventilation, and you have to monitor the vital signs continuously because tetanus frequently causes profound autonomic dysfunction like erratic blood pressure, tachyarrhythmias, hyperpyrexia. And you have to administer alpha or beta blockers or even Magsul, okay, as ordered to stabilize the sympathetic nervous system. For the wound and skin care, you have to ensure thorough wound cleaning and debridement to eliminate the anaerobic environment where Clostridium tetani lives. And you have to use pressure relieving mattresses and turn the patient with extreme gentleness. during periods of deep sedation. For the nutrition and elimination, oral feeding is strictly contraindicated, bawal, due to the high risk of trismus, lockjaw, dysphagia, aspiration. You have to initiate early nutrition via nasogastric or nasojejunal tube once spasms are pharmacologically controlled, or implement total parenteral nutrition. Yes. And monitor for urinary retention, severe constipation caused by pelvic floor spasms and heavy sedative use. And you have to insert an indwelling urinary catheter and administer stool softeners as prescribed. Okay. For the per type nursing interventions, for the ineffective airway clearance, you have to maintain the patient in a neutral, slightly elevated position if tolerated. Avoid hyperextending the neck because manually driving a spasm unless establishing an emergency airway. Okay? Administer muscle relaxants and sedatives before attempting necessary sanctioning, and monitor continuous pulse oximetry, capnography, chest rise, and prepare for early mechanical ventilation if spasms compromise breathing. Because sedation, guys, rationale ito ha, they lower basal metabolic demand and stops reflex spasticity, and reduces mechanical airway obstruction caused by lockjaw and rigid throat muscles. And for the risk for autonomic dysregulation, you have to continuously monitor the electrocardiogram for arrhythmias, decreased heart rate, and even labile blood pressure changes. And you have to administer beta blockers and Magsul exactly as ordered. And ensure continuous IV fluid access to manage fluid loss from profuse diaphoresis, because autonomic storms, guys, are a leading cause of death in modern ICU setting for tetanus, and Magsul stabilizes cell membranes and blocks excessive catecholamine release. Catecholamine, whatever. Imbalanced nutrition, you have to collaborate with a dietitian to calculate a high-calorie, high-protein enteral regimen. Yes. And you have to administer continuous enteral nutrition by feeding pump rather than bolus, and you have to monitor blood glucose levels every 4 to 6 hours, and maintain a strict metabolic profile sheet, because continuous isometric muscle contractions burn calories at a rate similar to severe burns or trauma. And continuous drip feeding minimizes gastric distension, reducing diaphragm pressure, and lowers the risk for spasm-induced emesis and aspiration. And for the risk for acute urinary retention and constipation, you have to maintain an indwelling catheter during the acute phase, and you monitor the hourly output, and you have to watch for sudden drops that might signal in urinary sphincter spasm. Okay, auscultate bowel sounds in all 4 quadrants every 4 hours and assess for abdominal firmness or distension. And you have to administer prescribed prophylactic stool softeners and schedule mild laxatives early, avoiding aggressive rectal stimulation, because sympathetic uncertainty tightly contracts the urinary and anal sphincters while spontaneously slowing down intestinal peristalsis, and even rectal stimulations can trigger a massive systemic reflex spasm. That's for the generalized. For the neonatal, guys, for the ineffective infant feeding pattern, you have to stop oral or bottle feeding immediately upon suspicion or onset of spasms. You have to insert an orogastric or nasogastric tube carefully under mild sedation to administer breast milk or formula, and monitor for abdominal distension and check gastric residuals before every feeding, because forcing oral feeds introduces increased risk of aspiration pneumonia due to unexpected pharyngeal spasms. And enteral feeding maintains nutrition and gut integrity. For the risk for infection, you have to inspect umbilical stump for redness, foul odor, or purulent drainage, and clean the site using aseptic technique, and apply prescribed antimicrobials if needed. Dapat needed to, char lang. Administer systemic IV antibiotics on a strict schedule, because eliminating the localized bacterial pocket stops the ongoing synthesis of the new tetanus plasmin toxin into the infant's circulation. For the risk of jaundice, di ba pag malaki ang tiyan, joke ko, guys. Yeah. You have to, buisit, tawang-tawa ko sa joke ko. Ako lang nakatawa sa joke ko, Diyos ko. Yeah. Monitor infant's color, the sclera, the transcutaneous bilirubin levels every 12 hours. Ensure regular scheduled enteral feeds to promote GI motility. And if phototherapy is required, ensure that the eyes are properly shielded and the light unit is completely silent. Because bilirubin, guys, it's excreted primarily through stool, and if the infant is not feeding due to oral rigidity, reabsorption of bilirubin increases in the gut, and phototherapy equipment must not produce clicking or sudden flashes, as these will trigger infant tetanic spasm. Okay. For the risk for altered or infant parent attachment, you have to educate parents clearly, guys. Educate, okay, as to why they can't hold, rock, or even speak loudly to the baby, explaining the mechanism of sensory triggered spasms. And you have to involve parents in quiet, non-tactile visual observation or low stimulus tasks like putting a drop of breast milk on the infant's lips if safe. Once the acute spastic phase stabilizes under sedation, you have to provide consistent emotional support and daily updates to mitigate parental guilt or detachment. You have to encourage the mother to express breast milk using a breast pump regularly to maintain her milk supply, because preventing physical contact, it's biologically counterintuitive for parents. It causes severe distress. Clear physiological education transforms their frustration into therapeutical cooperation, okay, and protecting the infant while keeping the parents engaged. That's for the neonatal. For the localized for the impaired physical motility, you have to support or splint the affected limb in a sorry, functional position using a soft padding, and avoid aggressive passive range of motion during acute stiffness phases. And you have to assess for local skin breakdown, and you have to rotate pressure points gently around the unaffected areas of the body, and you have to perform your vascular checks distal to the spastic muscle group, like your capillary refill, pulses, and even warmth, because forcing rigid muscles to stretch can cause structural muscle tearing and trigger a wide spasm network. And continuing localized pressure increases the risk of deep tissue pressure ulcers. Yeah, because deep tissue pressure ulcers. And yeah, risk for injury and disease progression, you have to administer human tetanus immunoglobulin IM near the wound site as well as systematically according to protocol, and maintain standard seizure and spasm precautions. And yeah, monitor patient hourly for early signs of descending systemic involvement, because your human tetanus immunoglobulin neutralizes unbound circulating toxins before it can cross into the central nervous system nerve terminals and cannot reverse toxin that's bound to neurons. For the acute pain, you have to assess pain using a validated scale, focusing on localized muscle cramping, tightness, and even guarding. You have to administer scheduled non-sedating muscle relaxants or even localized nerve blocks as prescribed, rather than relying solely on as needed na systemic na opioids. And you have to apply dry, neutral temperature support elements under the limb and avoid hot or cold patches, because localized tetanus causes deep constant aching pain due to muscle ischemia from sustained contraction. And temperature extremes on the affected skin can stimulate local sensory receptors and worsen focal spasms. And for the fear anxiety, risk for fear anxiety, pareha lang yan. Same shit. You have to provide calm, quiet, direct explanations of all planned procedures before execution, and you have to teach and practice quiet internal relaxation or visualization techniques that don't involve deep physical movement, because anxiety, guys, increase circulating catecholamines, which lowers the threshold for muscle motor neurons to fire, theoretically increases the risk of localized muscle spasms. And lastly, For the cephalic, it's impaired swallowing. Yeah, you have to keep patient completely, nothing by mouth, NPO, at the first sign of facial asymmetry. You have to initiate alternative nutritional access like your IV TPN as advised. And you keep a tonsil tip suction, ready at the bedside due to clear pooled saliva from the oral cavity without touching the back of the throat unnecessarily, because cranial nerve involvement impairs the normal airway productive mechanisms. Touching the posterior pharynx unnecessarily can induce intense laryngeal spasms. And for the disturbed visual sensory perceptions, a risk for corneal injury, you have to assess eyes frequently for corneal dryness, redness, and irritation. And you have to administer prescribed preservative-free artificial tears during the day. And lubricating ophthalmic ointments at night. And you have to gently tape the eyelids closed using hypoallergenic tape or apply a protective moisture chamber path, because exposure keratitis or permanent corneal ulceration can occur rapidly if the eye loses its biological protective mechanism or your blink reflex and it's left exposed to air. Risk for aspiration, you have to maintain a strict zero exception NPO status, nothing by mouth. Okay? Position patient in semi-Fowler's position. And side lying to allow oral secretions to pull forward rather than backward into the trachea. And you have to assess, guys, for the presence of spontaneous cough reflex and swallowing motions without inserting a tongue depressor into the back of the throat. Because encephalic tetanus, guys, the nerves controlling the airways, physical gaits are compromised. And secretions can easily slip into the lungs completely unhindered, causing silent aspiration and even subsequent or chemical or bacterial pneumonia. Okay? And for the impaired impaired verbal communication, you have to establish a simple, low-effort communication system that requires zero vocalization or intense facial movement. For example, one blink lang for yes and two blinks for no. And you don't ask complex questions that require long explanations, because, or shall we say, rephrase mong questions, as they can be answered with a sustained or established binary signal. And you have to keep a communication board or simple picture cards within direct line of sight if patient's eyelids can open, because frustration from an inability to communicate causes agitation, which spikes intracranial pressure and sympathetic tone, potentially triggering laryngospasms. And a low stimulation, low effort signaling system preserves patient's autonomy while enforcing physical rest. Dun, 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 dun. That's for the nursing management. Last slide would be boom. So yeah, medications to avoid. Penicillin G, nasabi ko kanina ito, that's the standard, but it's a known GABA antagonist. Okay? Alisin natin to. Yan, perfect. Because the tetanus neurotoxin structurally blocks GABA release. Therefore, it can theoretically synergize with the toxin. Therefore, it creates muscle spasm. Alternatives, metronidazole. Okay, guys? Non-selective beta blockers. Bawal siya because blocking beta receptors, leaves alpha adrenergic receptors unopposed. Therefore, there's a spike in blood pressure and bradycardia, which may result in cardiac arrest. Alternatives, esmolol and labetalol. Okay? Neuromuscular blockers should be avoided for sustained paralysis and repeated intubation. Alternatives, guys, yung vecuronium or yung pencuronium. Phenothiazines, those are medications that destabilize central nervous system signaling and reduces the threshold for generalized seizures and can aggravate baseline NM hyperexcitability. Alternatives, benzodiazepines. NSAIDs, bawal pa rin because they experience, guys, physiological stress combined with excessive sympathetic nervous system or overactivity. Therefore, it creates stress ulcers and even GI bleeding. Bigyan siya ng H2 blockers or PPIs. Anesthetics, like halothane, because if a patient with tetanus requires surgery, inhalational anesthetics are avoided because they can synthesize the myocardium to catecholamines. Morphine, bawal ang morphine because or shall we say use with caution. Correct me, I stand corrected. It's used with caution, guys, because morphine stimulates histamine release, which exacerbates hemodynamic instability and worsens respiratory depressions. Bigyan mo na siya ng fentanyl due to shorter half-life. Even antipsychotics, like your haloperidol and pseudoephedrine, because they induce severe extrapyramidal side effects like dystonic reactions. Sympathomimetics, like your epinephrine pa rin, because they can trigger arrhythmias, hypertension, and increased heart rate. Alternatives, bigyan niyo siya ng esmolol, magsul, sodium nitroprusside. And for the CNS stimulants, like this one, amphetamines, they increase excitatory neurotransmission, therefore bababa seizure threshold. And they are drugs that can act as catalysts that triggers violent tetanic spasms or opisthotonus. Or fluoroquinolones, like your ciprofloxacin and levofloxacin, they can act as GABA A inhibitors, and yeah, that cause CNS excitation, tremors, and decreases ang seizure threshold. Antiemetics, because bawal siya, because they can induce acute dystonia, and if administered, they can worsen muscle rigidity. And even aminoglycosides, they possess a known secondary side effect of mild neuromuscular blockade by inhibiting presynaptic acetylcholine release and reduces the postsynaptic sensitivity. Okay? And for the acetylcholinesterase inhibitors like your neostigmine and pyridostigmine, those are drugs that increase acetylcholine levels at neuromuscular junctions. And by preventing the breakdown of acetylcholine, drugs maximize the excitatory signaling at the motor end plate. Therefore, increased ang fasciculations mo and even tremors. And for the anticholinergics like your atropine, benztropine, and the min, they block the parasympathetic nervous system and removes the natural brake on heart and the blood vessels, which triggers tachycardia, arrhythmias, urinary retention, and even paralytic ileus. And for the corticosteroids, like your hydrocortisone, this suppresses the immune response needed to fight secondary hospital-acquired infections and can cause hypoglycemia. And for the topical antibiotics, like your hydrogen peroxide, bacitracin, and neomycin, because guys, Clostridium tetani is an obligate microbe. That is, yung, di ba sinabi natin kanina, yung Clostridium tetani, it thrives exclusively in deep, oxygen-depleted, necrotic tissue. Topical antibiotics only touch the surface, guys, leaving the dead tissue and foreign body intact, guys, which allows, guys, the vegetative bacteria to multiply and pump out more tetanus plasmin into the bloodstream. Alternatives, guys, surgical debridement, okay? And even macrolides, guys. Macrolides, your erythromycin and erythromycin. They are some of the potent inhibitors of the hepatic cytochrome P3A4 enzyme, and inhibition can cause sedatives to accumulate, therefore prolong ang coma or respiratory depression. Food to avoid: hard, chewy, solid foods, dry, crumbly foods, and even thin liquids. Because thin liquids can lead to aspiration, which causes suffocation. And for the safer medications, the immunoglobulin, and even anticoagulants, guys, like your low molecular weight heparin and UFH, or unfractioned. Smooth muscle relaxants, sorry for that. Your smooth muscle relaxants, they suppresses muscle spasms by acting on spinal GABA B receptors. And here's the dosage, by the way, on IV bolus or infusion. And dantrolone, primary treatment for prevention, management of hyperthermia, and interferes with calcium release in the muscle fibers that prevents contraction. And you have to avoid chlorozine or older sedatives that lack targeted GABA mimetic actions. And for the general anesthetics like your propofol, it enhances GABA A receptors and it counteracts tetanus plasmin's effect, which relaxes muscle rigidity, and it quickly reverses lockjaw. Okay? Ito. Madali lang ito guys. Affected cranial nerves. May legend ako dito. Primarily affected, secondarily affected, and even not affected. For the affected facial nerve, because it leads to facial asymmetry, weakness, paralysis that mimic Bell's palsy, and it causes sardonic smile as well. Ito, yung cranial nerves 3, 4, and 6, it leads to ophthalmic tetanus, and patient may present with ptosis, strabismus, or diplopia. And ang CN6 or yung abducens nerve that is frequently involved for a while. Perfect. Yeah. For the trigeminal nerve, yes, affected rin siya guys because toxin-induced masseter rigidity is that one, which results to trismus. Trismus, di ba yun may yung pag magano yung chismis pala yun. Sorry, na good. Yeah. And even the cranial nerves 9, 10, and 12. Because they are involved with swallowing, gag reflex, and even tongue movement. Pag sa mga tetanus, it's involved with dysphagia and hoarseness or aphonia. Hoarseness, pagaw, paos, kumbaga. Yan siya. And secondarily affected dito ang spinal accessory nerve because it's heavily impacted in generalized cephalic tetanus, and it increases hypertonus. It's not increases, it results rather in hypertonicity and spasms, which results to neck stiffness, torticollis, and even reticollis, and even will result to opistotonus in severe cases. And for the vestibulocochlear nerve, in tetanus, nerve itself, guys, is not paralyzed by the toxin, but vestibular and auditory disturbances are reported. Secondary to hypersensitivity of the sympathetic nervous system and spasms of the tiny skeletal muscles within the middle ear. This one, the stapedius, and even the tensor tympani, that's innervated by these nerves, causes hyperacusis or sensitivity to the sun, and even tinnitus. Bakit hindi affected ang cranial nerves 1 and 2? Because your Clostridium tetani produces tetanus spasmin, which travels via retrograde axonal transport and exclusively along motor or autonomic fibers to block inhibitory synapses in the spinal cord and brainstem, because the olfactory and optic pathways are purely sensory extensions of the central nervous system. Cranial nerve system, nabuang na. Central nervous system rather, and lack this specific lower motor neuromuscular junctions, and a patient with severe tetanus remains fully conscious and clear-sighted. And lastly, what are the affected organs or body systems? CNS, yes, because it's primarily targeted by tetanus spasmin by traveling backward along peripheral nerves to reach the spinal cord and the bloodstream, because the toxin selectively blocks the release of GABA and glycine from upstream interneurons. Sa mga walang neurotoxins, that signals muscle to relax, or shall we say, lagi. And for the without the tawag nito, with the neurotoxin, the CNS motor neurons fire unchecked. Nagkabaliktad lang dito, sorry. Sends continuous rapid fire excitatory signals to the muscle, which will result to stiffness and spastic paralysis. And for the autonomic nervous system, that's the part of a CNS anatomically that controls involuntary functions. Because affected siya sa may tetanus, it leads to instability and it causes fluctuations in blood pressure, tachycardia alternating with bradycardia, and even profuse sweating and fevers. Musculoskeletal, guys, and classically starts in the jaw and facial muscles before progressing down the neck, trunk, and limbs. And contraction can become so violent that the spine arches backward, yung opistotonus. And in severe instances, The sheer mechanical force of these spasms can cause fractures in the vertebrae and in the long bones. And for the respiratory, the respiratory failure is the leading cause of death in tetanus patients when the muscles responsible for breathing are compromised. And constant spasms affect the chest wall and diaphragm in a rigid state, and it prevents lungs from expanding and contracting to pull in oxygen. And it can also cause laryngospasms, therefore, it tightens vocal cords, that seals off the airway, therefore, it will cause acute asphyxiation. Due to the instability to clear secretions and swallow, patients are at a high risk for aspiration pneumonia. And ito, cardiovascular and even renal. Oo. Because autonomic storms over-secrete catecholamines, which places stress in the myocardium. Therefore, arrhythmias, cardiac arrest, and acute heart failure are some of the results. And last but not the least, ito to. For the renal system, rhabdomyolysis release increased amounts of myoglobin into the blood. Pag meron yan siya, myoglobin clogs the renal tubules, therefore acute kidney injury ang labas. So yeah, basically, yes, this is my pathophysiology of tetanus. Hiningal ako. So yun, thank you guys for listening in this long pathophysiology. And ayun, laban. Ayan siya. Grabe no? 3 weeks ko na ito eh. And hindi ko ito nagawa without Miss Yanna's help. Thank you po, Miss Yan, for this. And rooting for more collaborations in the future. And thank you po for the learnings you've taught me. And thank you for everything. From the proofreading until the verifying and giving the go signal for me to film it. And ayun, since busy ka po, I understand you. And ayun, thank you po for this. Thank you for this opportunity to be taught by you and to be guided by you. So, ayun guys. Thank you for this. And I will upload this with... Plano ko kasi hemophilia. Oo. Hemophilia and HELLP syndrome, pero magbentot-bentot na lang ako guys kung anong iuna ko ng video. So, yun. It's almost 3 in the morning. So, yun guys. I will edit pa ito and upload it right away. So, bye-bye guys. Thank you so much. And this is me. It's me, Joseph. A licensed teacher by profession and a student nurse. Na malapit na magkakaping and pinning this September. So, laban.